AXEL Wolf. Oh, sorry, that's the camera. My name is AXEL Wolf, and me and my colleague, ANDREAS FORS, will talk a little bit about how we use e-health as a tool in implementing and doing research about person-centered care in primarily patients with coronary heart disease. And I will give a brief background about e-health and person-centered e-health, and ANDREAS will talk more about the study we are doing about person-centered e-health. And the background is why person-centered e-health, and particular mobile technologies like smartphones. Why are we using them as a tool for person-centered care? And I think it's obvious that everyone are using them. It's estimated that in 2016 we have 10 billion mobile devices, which makes 1.5 devices per person on a global basis. The mobile internet usage will increase with 50% or 50 times, until 2016. And I think all we here listen to this presentation, if you remember your Congress bag 10, 15 years ago, how many devices you had, and maybe you're just sitting now with an iPad or a smartphone that does it all. So I think the smartphones are technology that is low in cost. They can be more cheaper, of course. They are easy to access. We know how to use them. So it's an interesting technology to use in person-centered care. Like you see, mobile phones will overtake. They have overtaken PCs, laptops, desktops as the most common web access device in the world. That was the estimate 2011, that it was done 2013. In Europe, we have 70 million users that access internet on a mobile device. Approximately 50% of the people in the United States own a smartphone. And we have an increasing trend that we are using our smartphones and mobile technology to get information, health information on the web. Here you have a chart from Cisco about the download, how much data we download on what device. And like you see here in 2010, it's a bad image, but you see it's kind of a balance between desktop and laptops, that's the gray area, and the blue area, which is cell phone and smartphone. But you see it's a rapid increase of device technology, mobile technology, which is driven by, a little bit harder, driven by smartphones. And as you see, the dominating device will be smartphones in 2017. The interesting thing is also, if you look at the continents, of course the development will be driven by Asia, will be driven also by North America and Europe. But if you look at continents like Africa, Latin America, they have increasing usage of cell phone technology, mobile technology, which maybe, if you look at the UN's Millennium Development Goals for health, for education, empowerment, shows that those devices may be a good help in reaching those goals. But there is also something that I want to talk about, and is how we use e-health and telemedicine right now. And I think we are using it still in a very traditional way. And this is a review of Stefan Anker and co-workers in chronic heart failure, looking at remote monitoring. And remote monitoring, I think, says it all in the name. It's a very traditional way. We want to improve traditional medicine. And they suggest a 4-generation path of devices, where you see the first generation is a non-reactive data system. We pull data from the patient. The patient we monitor the patient by a device. The system gets increasingly more advanced. So we, in the third stage where we are right now, are building a very big remote patient management system. But I still build on our perceptions that we want to pull information from the patient. We want to control the patient, monitor the patient remotely. And this will also be integrated fully. In Germany there is a project where you also can care on distance, where you can take blood samples, for example, on distance and analyze them and treat the patient in distance. So we can prolong the hospital's reach to the home, but I don't think that this is person-centered at all. And the evidence of the effectiveness of telemedicine, primarily in chronic heart failure here, is ambiguous in big studies. And maybe the answer could be because we don't really know much about how the patient wants to be treated. Maybe it is because it is very disease-centric and provider-centric. So we wanted to look more into what patients think about using e-health as a means of person-centered care and how mobile technology will impact them in that. And therefore, Andreas will talk a little bit more about the study we have right now.
Well, I will proceed and briefly present an ongoing study at the Center for Person-Centered Care at the University of Gothenburg, and it's also a part of my thesis. And it's called Person-Centered eHealth in Patients with Acute Coronary Syndrome. And our purpose or aim is to investigate the feasibility and patient perceptions of an eHealth application aimed for self-monitoring of signs and symptoms in patients with ACS. So, the study design and method. This is a sub-study of an ongoing randomized control trial in patients with acute coronary syndrome. 125 patients are randomized to person-centered intervention and 125 patients are randomized to usual care. And the person-centered intervention consists of several components where the mobile application is optional. Those patients who wants to try the eHealth, our application, they are trained at the hospital to use a smartphone application to interpret the visual trends of the signs and symptoms after discharge from hospital. And the interviews about patient perceptions are performed a few months after a discharge with patients who have used the application. And as it is an ongoing study, we have at this stage, we have conducted 8 interviews and we are about to conduct some more. So let's have a look into the smartphone application and the options that are available for the patients when they are using the application. We have developed it ourselves and we have as you can see, they can rate the current state of fatigue, activity, motivation and concentration. They can obtain daily train graphs of physical activity measured via built-in accelerometer. And the mobile app has no connection to the hospital, so it's only patient registration, it's only for self-monitoring. And as we can see, it takes approximately 20 to 30 seconds to report signs and symptoms for the patients. So again, this is an ongoing study. We have chose to call them tentative findings, and it seems like it's needed little instruction in using the smartphone, and approximately 40 to 50% of the patients in the randomized control trial are positive to use the smartphone as a tool after discharge. The interviews points toward very few technical usability issues, and the usage of the application leads to increased self-support and self-esteem, which today will be represented by these 2 quotations from 2 participants in the study. And they are saying, "It is supportive to be able to follow my health status daily and retrospectively. And it gives me a better understanding of how I feel and what situation I find myself in." So our conclusions so far is that our findings indicate the feasibility of a smartphone application for patients with acute coronary syndromes. We also suggest that smartphone-based eHealth diaries should be further explored in patients with symptomatic diseases, and that further research directions should explore the impact of person-centered eHealth on personal resources.